there are some big, long surviving healthcare sharing ministries out there that have been around for a while. You know, they'll say they've paid all maybe eligible bills, or, they who determines what is eligible, or those types of things. That's a different conversation. But then there are a ton of really small ones, right? I mean, you can do a quick Google search on some of the big ones. There's a big one out there that just has a lot of really bad press about it, and some money that was, not really used for medical bills. It was maybe kicked to some outside things for the people running it. And then you've got a ton of really small ones, right? That just they're kind of in the wilderness figuring it out, and they may not have the expertise, but Cameron, that's a great point. But there are a handful of really large established ones that have served people in amazing ways, right? They've paid billions of dollars in medical bills. They have, served people in really difficult times. And maybe there were some struggles in that process, but they still did, in essence, kind of what they wanted to do. So I think it's just important, like you said, for the consumer, is is it established? Is it large enough to handle large medical bills? Is it have maybe the professionals like an actuary or a consulting firm doing those types of things? Those are all questions you have to ask. And then you have to make an educated decision for you and your family.
That's good. Bob, you have some insights here on the Alex brought up the maternity piece, and I think just kind of like double clicking on that, like some of the pro-life pieces and the operating principles, right, of like these healthcare sharing organizations. Like you've got some points there to bring up some like good and bad on the HCSN.
Absolutely. Yeah. And I think it all comes back to, again, the question of regulation. Is it in a regulated environment or is it not in a regulated environment? And I would just, the question of whether the regulation is good or bad, it's not a black and white issue, right? Like there's some places where regulation is good. There's some places where it's overstepping. And the lens through which I would analyze that question is the principle of subsidiarity, which says that issues should be addressed and solved at the lowest level that they can effectively be solved at. And when you apply that into the healthcare landscape, the answer and outcome is a little bit complicated. And it kind of depends because we have all sorts of interactions and touch points with the healthcare industry, right? And I'll highlight two places where I think having these healthcare sharing ministries in the non-regulated space is actually a win, a net win for our economy right now. And the first place is relatively low dollar amount healthcare interactions or healthcare services, right? And I'm going to define this as it. I mean, it can be different for different families, but I would think of it essentially as like, at what level is the risk of not having a healthcare bill paid going to be financially damaging to a family? Would the family be at risk of bankruptcy, right? And let's just call it $50,000 for the American family. It's not a small amount. I'm not saying it's a small amount, but if push comes to shove and if you had a $50,000 bill on your table that had to get paid, a lot of American families, I'd say average American family could probably figure out a way to get it paid without risking, bankruptcy,